Welcome to a couple of Rad Techs podcasts where we bring you an inside look at the world of radiology from the unique perspective of a married couple of radiologic technologists. Together, we have years of experience, exactly 30 years in the field, and we are here to demystify the science of medical imaging. Radiology is the unsung hero of the medical field, providing doctors with crucial images and information that help diagnose and treat illnesses. Join us as we explore the latest techniques, technologies, and innovations in radiology and discover the vital role we play in the healthcare industry. So, come along for the ride as we share our passion for radiology as a married couple.
How I started in nuclear medicine was I was going to college and I was doing my bachelor's in biochem, and I was in my second year or third year, and I realized I don't know if I wanted to do biochem. So I kind of ended up doing a double major in biology and chemistry. And I kind of did okay. I graduated, and I was like, okay, what's the next step to take my MCAT? So I took my MCAT and I didn't do as well as I would have liked, and I can't probably could have took it again, but the passion wasn't there. The passion wasn't there for me to be a doctor. I didn't think that was what I wanted. And I decided, okay, you know what? Well, what else is there? I know there are so many jobs in healthcare, right? And that's what a lot of people don't realize too. There are so many different jobs in healthcare. So I decided, okay, let's go to had a family friend who lived in Missouri who was a doctor at a hospital, and my mom reached out to them and said, hey, she kind of wants to do radiology. She be able to go there and kind of job shadow? And I did that. I went there and I job shadowed in MRI, job shadowed in ultrasound, and job shadowed in CT. And then when I got to nuclear medicine, I was like, wow, this is cool. This is like, we get to look at like the function of organs. We get to work with radio tracers, and it just kind of blew me away. And I was like, this is what I want to do. I want to go to school to be a nuclear medicine technologist. And I started researching about it, found that there was a program at the University of Missouri. I applied there, and then I applied to a college in Florida, or Barry University.
Right?
And I got into University of Missouri gave me a scholarship, like a slight scholarship. And when I looked at the pricing, I was like, University of Missouri was a lot cheaper. And I spoke to the program director and I did an interview, and, I was like, you know what, this is where I really want to be. So then I got in and I started there, and I did my second bachelor's in nuclear medicine, and that's how I started
Oh,
in the
wow.
3 year.
Well, that's nice because now
Yes.
you're talking about something different because most people think everyone who's in imaging goes to x-ray school. But that's what we're talking about today. There are different pathways to reach the imaging profession. And I love that that's what makes us the third largest medical profession in the nation, is that we encompass so many different pathways to imaging. We have so many different ways of doing it, so many different modalities, and nuclear medicine is one of my favorite as well. I love nuclear medicine, but we're talking about a primary pathway. And can you explain a little bit in detail, kind of just for the average person or those new technologists, maybe people out there in school that don't really understand what a primary pathway is? How did you use that avenue?
So the primary pathway is like basically you go to school for that specific profession. So you don't really have to go through x-ray and do that schooling, become x-ray certified, and then go back to school or do some kind of continued education to then be certified in something else. Nuclear medicine is a primary pathway, ultrasound is a primary pathway, and then now MRI is a primary pathway as well. So a lot of these professions kind of broke off because they realized, hey, we can go directly into training these because they're so different compared to X-ray. And so that's what I did. Now I have my MRI and my CT certification, and I did that through secondary pathway where I did
So we'll talk
a
about that.
program. Yeah.
Yeah, we'll talk about that. So when you talk about primary pathway, is there something you have to have? Can anybody just say, I'm going to go to school to be a nuclear medicine tech? You already had a bachelor's. What kind of things do people need to know before they say, I want to jump out here and do a primary pathway for nuclear medicine or radiation therapy or MRI?
I think the thing that you should do is job shadow. Actually, find a way that you can maybe volunteer or find out, connecting with other, nuclear medicine technologists or whatever field it is that you're interested in, and say, hey, can I come and, in your department and kind of job shadow and just see what the profession's about? Because I think that's really important that you understand the pros and the cons with the profession, because with everything, there's pros and cons. And I think that's what I did too. That's how I decided on nuclear medicine as well, because I just felt like, for me, I was really interested in it, and I realized the cons of it, right? Being exposed to radiation.
Right.
And to me, I was like, well, I realized that there's ways to prevent that, right? Time distance shielding, there's things that you could learn versus other things. But I felt like, okay, but I have the passion for it. And I think that's the important thing, that you actually have the passion, you like what you do. Like, not doing it just because it's a job.
Right. Yeah. I mean,
Right.
that's one of the important things is I love that you said the pros and the cons because yeah, nuclear medicine techs make great money. Imaging in general makes really good money, but you have to love it. You do have to have some type of passion and it takes some brain knowledge too. I mean, nuke med school is not easy. None of these schools are easy, but you're coming
Right.
with I think you said a biochemistry background.
Yeah.
You were headed the doctor path. So most average people aren't, maybe, going the doctor path, but that is just it shows the level of education that you do have to have. We're just not there pushing buttons. You're dealing with
Right.
radioisotopes. I mean, that's major. So kind of tell us, you talked a little bit about your secondary pathways. So I love that because I'm a CT and MRI technologist as well. And how did you go into from nuclear medicine to the secondary pathway of MRI and CT, and in which order?
So the reason why I decided to even cross train in or to learn these secondary pathways is because I attended a meeting, and which I think is very important for people to attend meetings to kind of stay abreast in what's going on in their field. And I saw a talk on PET MRI, and I was like, wow, look at that. Like, so, look at what they're doing. Look at the imaging that they're doing. Look on all of the things that they're able to do for these patients, the research, the cancer imaging that they're doing. And I was like, I want to do that. Like, it just looked amazing to me, and the fact that it was so new because this was probably like 10 years ago. And I was like, only I think probably about three or four places in the world had a PET MRI machine. And I was like, okay, I want to do that. How do I do it? I started researching, like, how do I get into this? And in the mail, I got this like a mailing, and it said, if you want to be certified in MRI. And I guess, they probably got information from nuclear medicine technologists and x-ray people who are registered, and they mail it all in this information. So I got this mailing about, oh, come to, you can, do didactic learning and then do your clinicals at a place, a program. And I researched it and I looked into it and I was like, okay, this is good. I can do this within like 6 months, But it was very affordable. It was also on the weekends, mostly like the learning part. And so I was like, okay, something I can do, so that I can achieve this goal that I want to achieve. When I started, actually, I was like, okay, let me do CT first because PET CT was out and about, and it wasn't as popular as now, but back then it was still, prominent. So I said, okay, I'm gonna do CT first. So when I started the program, the director was like, oh, in Florida, because I was in Florida at the time, they're like, oh, you're are something to do with the license. They were allowing us to like nuclear medicine technologists were being allowed to modify their license, but it wasn't like completely finalized or something like that. So he said to me, well, in the meantime, while they're trying to finish this up, it should be ready in a couple of weeks. He's like, you can either wait a couple of weeks and see if everything happens, or do you want to start MRI? And then after you're done, then you can switch over to CT. So I said, yeah, sure. So I did that and I became MRI certified, and then I started working in MRI in the night, in the evenings. And then after about 6 months of doing that, then I started the CT class and I completed the CT class, and then I started working in CT, and then I became like an all around tech, because at the time too, the job market was really rough, especially in Florida. It was hard for a nuclear medicine technologist. There weren't not many jobs. And so I was like, I want to make myself more marketable. I want to be able to do all kinds of stuff, like say, be a well rounded person. So I worked MRI and I got my experience. And then eventually I moved to days, and then I got my CT license. And so I just made myself available. Do you need me in CT? I'm in CT. Do you need me in MRI? I'm in MRI. If you need me in nukes, I'm in nukes. I became that multi-modality type. In that place, it was great for them because it was a smaller imaging center in Florida. They really valued that. They valued a multi-modality person because it helped them out, and it helped me out because I got my experience as well.
Yeah, I think you make a very valid point because what some people miss is that in order to be well rounded in this profession, you've got to be flexible. You got to be willing to say, hey, you need this. Even if I don't know it, I'll learn it. If you want to teach me, I'll
Right.
learn it. I remember early on in my career when I first started out in CT, I went straight from x ray school into CT and I had to take the junk shift, and other people were like, oh no, but I knew I wanted to do beyond x ray. So that meant,
Mhm.
having to take that second shift job and it only be PRN
Mhm.
versus a guaranteed X-ray full-time position, probably 7 to 3:30 or 3:12s. Yeah, that would have been comfortable, but where would my growth have come from there?
Right.
And that's what I was thinking beyond the future, how to make myself more marketable. And I love that you said all of those things to those that are listening on this podcast. If you are in school for radiology or imaging, one of the forms of imaging, really, really rewind and listen to what Nicole just said, because facilities that you're at, or maybe ones that you know of, might be in need of MRI tech. And they've tried people that are seasoned and they just can't get anybody. They probably would say, you know what? This person at least can scan a brain. This person is at least registered. They can at least scan brain spines. We could teach them the rest. We can teach them
Mhm.
our way, how to do it, and that'll give you experience. So maybe you don't come in with the best shift. Maybe you don't come in with the top money when you first get in. But what you get later on is a triple modality or quadruple modality certified registered technologists who can now command more money, command, the shifts that they want, and even do other things that make you more flexible. And that's what Nicole, I really love that you brought that point out, is that you were like, you know what? You need that? I can do that. Or I'm willing to learn how to do that.
Yeah.
And I think more people should really like rewind and listen to that. And really, that's how you're going to become where you want to go. That even serves you for leadership. And I know we talked before about, your goals as far as where you want to go with your career, and all the things that you're doing sets you up for those leadership roles, right?
Mhm.
When it comes to nuke med, so you said you were in Florida. The laws are a little different state to state,
Right.
in here, because we in the US we have some states that are licensure, some that are not, some have a limited license when it comes to radiation and radiology. So each state is different. What did you find being in Florida and becoming a triple modality technologist, and now you've relocated to another state? How did that change your or make you more flexible? I would say it didn't change because you still are killing it with the modalities and doing what you do, but how did that make you kind of have to pivot?
So coming to California, I realized that I was not able to do CT as a standalone tech. So that made me realize, okay, well, uh, the jobs had narrowed a little bit for me because I could do MRI because MRI is not state regulated right now, but nuclear medicine is. So in order for me to be a standalone CT tech, if I wanted to have like a PR and CT job, I would have had to have gone to X-ray school, so I'd have to have my X-ray license, and then I can do CT. But I can do PET CT because that's under our scope of practice, right? Because I have my CT license. So I think in that sense, that was the only difference really for me because, like I said, I already have my MRI certification. I think it would be different if I didn't have my MRI certification, then I would have probably been like, okay, it would have been a lot harder because we also, I think some people maybe not know, I know this is also a really popular question with people trying to get into MRI or are just graduating. They're like, because I used to be an MRI clinical coordinator as well. They would ask me, is there a difference between ART and ARMRIT, which is the
Mhm.
other certification, which I have both. And I said to them, honestly, there's no difference. It's just that ART is a little bit more popular, it's more well known, but they both require certification. Some hospitals require ART certification, but I do think that that's changing now.
I
I do
agree.
think yeah, I think they're realizing that, it's not really just ART, there is ARMRIT as well. So I've seen when I was a clinical coordinator that some hospitals have modified their job postings or their job descriptions to include ARMRIT. Now, there's still some hospitals out here in California where they require the MRI techs to have their RT certification. Now, that I don't think is fair because I don't think MRI and MRI and X-ray have anything in common. So we're hoping that that would change and then MRI tech, because I don't think that that's needed, because especially how MRI is its own primary pathway now too.
Yeah, I think one
Yeah.
thing about on the East Coast where I'm at, I remember when Emmerich came and a lot of techs were trying to move to the East Coast with it, but a lot of hospitals only took ART. I do find the job descriptions are changing more. The hospitals are opening up more to it out this way. I don't think they're, as long as you're certified. I will say this, if I was, I do see the benefit of them requiring it because such a shortage, it will make the techs more flexible. That's the only way because when I work out in California, so they used to require me to have an X-ray fluoroscopy license, and I'm like, I don't even
Mhm.
do, like I'm not even doing
Right.
ionizing radiation, so it didn't. But I went on and got it anyway. Hey, that's what they require. I got it. But I will say, after working in different places around the U.S., I could see how facilities do want you to have an X-ray background because if somebody calls out, they got a tech over there. Hey, I need you to come up from MRI. You can at least shoot chest. You can at least, shoot a foot. I mean, I could at least do that. I haven't done X-ray in 20 something years. I cannot do the
Right.
major stuff unless I pull out a Merrill's book, but at least they have a body there that if somebody
Mhm.
needed something, or needed to fill in, I could see how that's beneficial, especially at smaller hospitals. Like if you're out, say Wyoming,
Like
somewhere,
maybe, yeah.
yeah, where you've got, I work in a big city, so, but when, in the smaller places where they literally have like one or two techs that do everything, I'm like, wow, I've never been in a place that, like, so I could kind
Right.
of, I've never seen that. But once I got exposed to it, I was like, well, I do see why they would require you to have an X-ray background because they just can't have somebody there that can only do one thing. So in that sense,
Yeah.
yeah. But a full big hospital, yeah, you got plenty of people that, could cover. But that's the only reason why I could see that they would require an X-ray background. It kind of saves them in a pinch and make their dollars
Yeah.
stretch too. I mean, you got several techs
Yeah.
that can kind of float and do everything. So if somebody's on call, so I do see that much. But MRI is its own pathway, and maybe things will change. But in the future, because they are seeing a more increase in that as a primary pathway. So let me
Mhm.
ask you, as far as your transition to Florida to California, because I think that's important. People need to understand it when you do the primary pathways, which a lot of people don't understand. Even technologists don't really understand it. You could read up on it in the ART, but a lot don't really
Mhm.
understand. When you move from state to state, what you may do in one state is not going to be okay in another state. So before you make
Mhm.
your move, try to figure out, is this a positive move for me with radiology? So I think sharing your story kind of opened up my eyes, to, hey, some states have license, some don't. So, some have limited scope practices, some don't. So
Right.
that's really important that people, because you want to be able to move. You've been doing this forever. You want to be able to move wherever you want to move and still have a job. But you have also shown the importance of having multiple modalities because when you made that change, it wasn't like nothing stopped you. You still had two
Right.
other modalities to, hey, I'm good with two other ones. So that's been a lifesaver for me as well. Sometimes the job market is low in CT. Well, I know how to do MRI. I know how to do mammo. I know how to do X-ray. Being multi-modality, I couldn't stress that more. And I think you're just driving home the point of whether you choose something as your primary pathway or not, have the flexibility of being able to pivot in the job market by being certified in as many as you can and actually know how to do them. Because that's the thing I think you
Yeah.
said too. You know how to do them. You're just not on paper certified. You could jump in and do them
Right.
all. So that's huge. And you took advantage of an opportunity. And it really shows, that you do love the radiology industry and you are really, just doing it. I mean, I don't think I've met anybody who's done a pathway like that. I mean, I'm so impressed and just enjoy this conversation. I know our audience will as well. Now, like, I got to ask you, how are your IB skills since you do all the modalities that require putting an IV?
So honestly, I think my IV skills are pretty good. Now, the only thing is that I notice, like, if I go from facility to facility and the equipment is all a bit different, it takes
Yes.
me some time to get used to it, right? So I struggle with at the beginning, like, just the little bit of technique here and there. But once I get it, I'm good. And then also I'm in like where I'm right now, we have a lot of really cool gadgets, right? So we have like the really nice IV finders, and
Oh,
so that's really helpful, especially where I work for a cancer center. So
okay.
we have like really hard sticks sometimes, so it's just like that helps. And then just like the little tips and tricks, like as I've worked in the field for many years, that you pick up along the way from different people, like hot packs and
Hmm.
warm towels and using a blood pressure cup. I've used a blood pressure cup instead of a tourniquet before because I just couldn't, get the pressure enough on the patient's arm. So, having them lay down or, just the little things where when the patient comes to you and says, I passed out before on my IV. Okay. All right, let's lay you down right now because if anything happens, you're already laying down. We're not, passing out on you. So, and that's these little things. And I think it's a great thing that you bring that up because one of the things I was talking to, because we have students at my center too, and I love working with students. I
Me
love
too.
working with students because I think I love seeing them kind of coming in and you trying to kind of help them get to the career that they want to be, because I think it's really important that we build these new people coming into the profession to make it only stronger, right?
Yeah.
So one of the things I always tell the students is that always be teachable. I have doing this for 12 years or 13 years. And till this day, every day I'm teachable. I don't know everything. Nobody knows everything.
Mm.
So sometimes they'll come in and they're like, oh, I heard this in class. And I'm like, really? And they teach me something. And I'm telling them, like, always be teachable. Like, that's, I think, also something that makes you a better person, a better tech in general.
Yeah, I totally agree. I
Yes.
enjoy working with students, and I love. I always believe that there's more than one way to do things in life. Period.
Yes.
But especially in the imaging world. I mean, we've all had that teacher that if you don't click the mouse with your index finger, it's wrong. It's like what?
Or they come and they adjust that slice just 1 degree.
And when I work with those students who work with text like that, they're like, "Is this okay?" I'm like, "Do you have L1 through 5 in there? As long as you got up to S1 and L12, T12, you're good. But is it it's
Yeah.
fine as long as you didn't clip anything? It's fine.
Yeah.
I'm not. It's not that serious. I mean,
Right.
I will maybe move it, but it's not gonna make a difference. Don't get caught up. And
Right.
I try to put people at ease, but I love working with students and helping people to show. I like to show them a way of doing it, so then they can take each person that they work with and say, okay, I'll pull this from her. I'll leave that over there with him. I'll pull this from her, and then I'll do my own thing with all of those things. So yeah, I love working with students. And like you say, I see them do stuff and I'm like, oh, especially if you're working on certain machines. Like for me, when I work on Siemens MRI machines or CT machines, there's like 3 different ways to do one thing.
Mhm.
And when a student or someone comes in and maybe I find the Scout localizer one way and they find it another one, I'm like, oh, that's how you do it. Well, and if somebody has their own way to do it, I'm like, now I know a new way to do it. Now I'm still going to do it my way because that's what I'm used
Right.
to. But hey, I just learned something, and you always learn something working with people, and that is the benefit of working with others too. But IV skills, yeah, I used to work at a cancer center. We never had those finders until I got to interventional, and I'm like, wow, you guys have the good stuff in here.
Yeah, it's a lifesaver sometimes. And there's, you know what? There's two different type of texts. There's texts that are like, no, I don't use that at all. Like they don't believe in it. I have some that, but they're good. But for me, if I have a really hard person and I'll go get that IV finder and I use it as like a confirmation, as in like I think I see it, I can feel it, but just in case I need like if it moves, I have it right there. And I would tell you it has helped me tremendously on those people that are just really hard sick because we have patients that, it's just hard. It's so difficult. They'll come and they will like, yeah, I'm just really hard. The last time I was here, they tried me 5 times, and it's just hard. And those things just help.
Some days it's not my day, and I'm pretty
Yes.
good with doing IVs, but some days I'm like, you know what? I don't feel a thing. I don't see a thing. I'm just going to go get somebody else. I'm not even going to try to stick you.
And that's okay. That's the thing too. I always tell the students that is okay. Like if you're just having an off day, you are having an off day. And thankfully you might hopefully be in a place that you're not the only one. Now there's been I've worked in places where there ain't nobody else. It's you or nobody. So you got it, and I always make sure the patient's okay. Like, are you okay? Like, do you want me to continue trying? Most of the time, I will tell you, they already know that they're heart sick and they say, I'm fine. Like, Don't worry about it, keep going because I know I really have to have this test done. And then sometimes I'll tell the patient, because the day before I'll say, hey, make sure you drink a lot of water before you come in here the next time, the day before. Don't wait till the morning of, the day before. It just makes a huge difference.
Yeah, yeah. I do want to ask this because you do three modalities and you have different type of machines. I know just for me doing CT and MR, those two, and I work on every last machine that there is that does CT and MR. And sometimes if I haven't worked on GE in a while, I sit down and I'm trying to do the same thing I do on Siemens, and I'm like, wait, that's not how I scroll through images on GE. That's not how I find it on Siemens or Philips. Every machine has their different ways of doing things, and it's the same thing, but they just have their different ways. When it comes to you working on different machines and modalities, how is that? Because you are triple modality. How is that? Is that kind of frustrating, or how do you find it?
You know what? Honestly, I think for me, the different modalities, even though they're different machines, like GE kind of has like their same across the modalities. I feel like there's still like some of the stuff is kind of the same. And the same thing with Siemens, like their single is pretty much the same across the platform. The platform's the same across the modalities. So I
Hmm.
can find certain things in the same places. So I don't know. I just feel like I think I'm more of a Siemens person because I like how they're really user friendly, I feel like.
They are.
They
I will
are,
agree.
yeah, user friendly and it's more closer to like not really a Windows based, but kind of Windows based, has like the functionality, whereas GE is not really. I haven't really worked on any brand new GEs, so I can't compare, but like the older GEs, I just feel like it's not as user friendly, or a lot of the things that you can customize on Siemens, you can't really customize
Right.
on GE. Right. So I don't really, I kind of tend towards loving Siemens a little bit better, but I like both.
Yeah.
I even worked on Philips too. Philips NucMed, but Philips doesn't do NucMed cameras anymore. And I really liked working for Philips. Their machines, I thought they were really great, but they stopped producing
Oh,
NucMed cameras.
okay. Wow, that's interesting. So,
Yeah.
see, now we have a perspective too. I like to talk about the machines, the technical skills, all of these things in any of these modalities. I like to show people who are listening who don't have a radiology background that we do a lot when it comes to, not just taking pictures, but we have to do IVs, we have to administer contrast and radioisotopes. And you talked about the pros and cons, being flexible, going from state to state. What tips would you have for patients undergoing a nuclear medicine exam?
I think for them, a lot of them get really like scared and they don't know what to expect. So I think just let the technologists know when they show up to the department and say, hey, this is my first time. I've never, for example, a bone scan, pretty one of the most popular exams that we do in nuclear
Hmm.
medicine, very straightforward. But it can be overwhelming the first time, and there's a lot of waiting, not really waiting time, but there's a lot of time because the patient will show up to the department and then we give them an injection of the radioisotope and then they come back 3 hours later and they do their picture. So I think for them to just kinda let the technology know, "Hey, it's my first time. Can you kinda explain it to me? Can you, walk me through the process?" So, because there's 2 appointments, they come for the injection and they come back. So ask them, when I come back, how long is it gonna be? Am I gonna be laying down? Those type of things. Just ask them to kinda walk you through the process. I know that when I get my patients back, I kinda give it to them, the whole thing from the beginning to the end. And then I ask them, "Do you have any questions?" And then I make sure I explain everything to them. And I also kinda assure them, like, "We do this all the time. It's a very small amount of radiation, that we're gonna be injecting in. For the bone scan, there's not really much precautions for you." And then they see, like, because we get our, injections in, like, a big kind of lead pig, we call it a lead pig, and so they see it, they're like, "Oh my gosh, like, this looks really, like, scary," and
Yeah.
I tell them, "It's not for you, it's for me. It's more for me than it is for you because I handle it every day, so
Hmm.
it's to help my ex reduce my exposure because we're handling it," and then they kinda calm down a little bit, and, I just kinda talk to them as a patient, like, "Why are you here?" "What are they trying to determine?" I think it's all about just treating them as a person, not by their ID number, right? Or
Hmm.
"What's your name and your birthday? Can I see your wristband?"
Yeah.
It's about the passion. I think that's one of the things that I always talk to with my coworkers too. It's like I always want to treat my patients like they're my mom or
Hmm.
my brother, or like at the end of the day, why are we here?
Right.
You know, why are we here in this field? Why are we doing what we're doing? It's yes, we earn money and that is obviously a big part of it. But I think if that's the only part of it, then you're not going to be happy.
Yeah, because
You're
you're
not
gonna
going to
be
be
looking for
happy.
something else to fulfill you in the future if it's just money.
Yeah.
Now, you talked about other modalities. I know working in CT, but a lot of times we worked very closely with nuclear medicine tech. So they would either put the IV in, call us and say, now I have your same patient at 2 o'clock. They're here with me to get their injection. They've got 2 hours in between. What would you like, a 20 or a 22 gauge? And where would you like it? In the
Yeah.
AC, right or left AC, or does it matter? So we work closely with nuclear medicine when I worked in a cancer center in CT. What other modalities does nuclear medicine work in conjunction with, or is it just CT?
No, so we work with IR a lot. We work with T and X-ray too at our facility as well, because in our cancer center, we do a lot of things that a lot of places don't do. So we do therapy treatments, and so the IR doctor accesses the liver vein or the tumor, and then we prepare the radioisotope dose, and then the IR doctor injects that in the IR suite. So we work with them a lot. And in order for that therapy to happen, they have to do pre-imaging in nuclear medicine to determine the amount of dose that they're going to give to the patient. So that's done prior to that too. So we see those patients twice. Actually, we see
Wow.
them like as they call it a pre-mapping for the treatment, and then they have the actual treatment date. And then in X-ray, a lot of times we call this a liver pump scan, where the patient has a liver pump put in under surgery for their chemo treatment to be delivered. So what we do is it's access under fluoral, and then we inject a radio tracer into the liver pump to make sure that the pump is working prior to the patient going for their chemotherapy treatment, to make sure that it's going to be going to where it should be going and not anywhere else. So we work with multiple modalities, and then now we're doing a lot of what they call theranostics. I don't know if you're familiar with that, but
No.
it's basically therapy and imaging together. So a lot of one of the most popular ones right now, become very popular, was in the news and stuff. It's called Pluvicto. It's for prostate cancer treatment. And it's for patients that have already gone through chemotherapy, immunotherapy, and they have metastatic cancer, basically. And it's kind of like on the last resort, but it's this new radioisotope that is given to the patient. And we can treat the patient with this injection. It's 6 treatments. And then we can also image as well with the same thing. So that's why it's called Theranostics, because it's a pair. It's a therapy pair and an imaging part component as well. And so this has really we started this treatment at my facility in last year, I believe November or so. And we just can't that we have so many people on our wait list because they just cannot produce the isotope in enough quantity right now. It's supposed to start getting better because this isotope comes all the way from Italy, and it's a short half-life. So, and it's prostate cancer, right? So we have many people with prostate cancer.
Hmm.
So it's just hard to get that radioisotope here in such a short amount of time. So they weren't able to produce it enough, and they have production problems and stuff. So the FDA just gave approval to, I think, a plant in New Jersey for this company.
Mm.
And
Okay.
hopefully that the dose will be more available, because the side of nuclear medicine pleaded with the FDA to expedite the approval so that then we can start producing this drug to help these patients.
Wow.
Because according to the research that's come out, is that it's helped these patients tremendously. So we're excited to do that. I think it's great. These patients are really grateful to start receiving this treatment, but it's very hard to get right now.
Well, this is I got to have you back. I want to talk about all of those ways because I think I'm so glad I asked you that question because so many people just think they can just jump in and do imaging's job because they have a limited knowledge of what we do. some of us have a limited knowledge of what we all do. It's so many modalities within the imaging umbrella. And really having
Mhm.
these conversations help me as a technologist and other technologists, and then those in the nursing field, doctors, radiologists. Some radiologists, they only read breast. They only read musculoskeletal. They don't know what all we do because they only have a limited experience with a limited number of technologists. And my mind is blown by what you were just talking about because I worked in cancer research with a urology group for years. I worked in a cancer center, was my first full-time job in CT. So, and I have a family member with prostate cancer now, and cancer runs very prevalent in my family. I actually just had genetic testing done to see, because I've constantly had lumps, just to see if, and family members that have passed away and had complications from cancer. So I wanted to see, did it fall in my genetic marker? It happened to skip me,
Right.
but it's very strong in my family. So this really is just amazing to me what you're talking about, this therapeutic and the nuclear medicine together, because even the X-ray and nuclear medicine, I didn't know that. I didn't know X-ray and nuclear medicine. That was mind blowing for me as well. And I just love to have conversations like this because it is so powerful what imaging, when they say we're the eyes into the body, we truly are the eyes into the body, and really helping everybody to
Yes.
understand that there's more than one pathway into the imaging field. And you don't have to just be stuck in one of those pathways. Some people say, well, X-ray is the only way, or I left because I wasn't making any money. You said it best. If money is all you're going for, you wouldn't last in the modalities at all, no matter what modality you went to. But you have to have a passion for wanting to help people and also wanting to advance and learn more,
Mhm.
in the field, because there's so many ways. I think we have more flexibility. What about you? I think we have a career that has way more options than a lot of other medical professions.
Yeah, no, I agree. I think, and then also it's not also if you want to, you can transition to education too, because I did that briefly also. So there's so many ways, I was a clinical coordinator, or you could be a assistant professor at some point, or an adjunct professor, or, teach a class, or you could tutor other students as well that are currently, in school. So there's so many different avenues in the imaging world, and it's just really what do you want? What do you want to do? What are you happy with? And I think for me, I liked both. I love working in the clinical part, but I also love the education part too. Like I said, I love working with students. So I'm happy that where I work, I'm able to work with the students and be hands-on with them. And like it's so funny that you talked about IB skills because we have students come in and they struggle, sometimes. And I just keep telling them, like, don't let it defeat you. You just have to, the only way for you to learn IVs is to do it.
Yeah.
There's no other way. You just have to do it. So don't let it defeat you. And I will try anything to help them out. Like I will grab a pillow and I'll be like, okay, pretend this is a patient's arm and here's the IV and this is how you're gonna do it. And I'll give them all the tips and tricks and whatever works best for them. But I think that's the thing is encouraging them too and not like beating them down and saying, hey, no, like, oh, you only get one try. And then if you don't get on the first try, then you're done. I don't the patient's okay with it. I always make sure the patient's okay with it. Are you okay? And if
Right.
they're fine with it, then go right ahead, because we're all students. We were all students.
At one point. At one point. It's-
At one point, yeah, and so I look back and I was like, I had a great experience, but I also had not a great experience at some places that I was at. So I'm like, I don't wanna be like that person, and I wanna make sure that I'm training these people to come up into the field so that if my mom shows up to this department, I know she's gonna be taken care of, I know that they're gonna do the right thing because people are training them. And you're only as good also sometimes from who you get trained by
yeah.
too.
And your
So
receptiveness to the training. And
yes.
because everybody
Yes.
doesn't want to be trained. Some people come in thinking they know everything, you know. So, and it's a
Exactly.
two-way street, I'm the same way with you. I've been in places where it's like, oh my goodness, I can't wait to get what I need and get out of here, you know. But as soon as I can go, I'm going. But, we've all been there, and then we've been on the other end of like, oh my goodness. I'm so grateful that when I started out, the people that I rotated with, the technologists, they were the bomb. I mean, they really were supportive of me and really encouraging me to really get as many certifications as I could. Like, if I don't think there was a person that didn't train me that didn't encourage me to get more certifications. They were like, just get all the certifications you can get them all, and don't just do the modality, get certified in it. They really preached that. And I'm
Mhm.
so grateful. And they showed me the tips and tricks of how to work smarter, not harder, and how to
Mhm.
give good patient care at the same time, how to take the initiative, how to be a go-getter, and it will serve you well. So as final thoughts, I really want to hear from you. What closing remarks or inspiration would you have for not only students, but technologists as well? Because there are many technologists out there listening. This community that listens to this podcast, many of them are looking for other avenues to go into. And really, I think you could give them some words of encouragement, as well as students and those who are listening. Maybe they're not sure what to do after high school.
I think for me, I think it's just staying abreast of what's going on in the field to keep kind of staying up to date. If it's going to meetings, one of the things I'm a huge proponent for is going to a national meeting. Like if it's for us in Nuclear Medicine, Society of Nuclear Medicine and Molecular Imaging, or going, like I haven't been able to go to an RSA meeting, but my goal is within the next couple of years, I would love to go to an RSA meeting, RSNA meeting, or ASRT or anything like that. Whatever your modality is, go to a meeting, network with other technologists, see what they're doing or what they're doing in their facility, and just kind of learn. Just keep always learning, and seeing where can you grow as a person. Because sometimes too, it's not only growing in the imaging field; it's growing in other areas that will make you a more well-rounded person. Or even in your hospital or your facility, like where is there a need that you could fit into, like, what maybe there's a committee that they need somebody to help
Mm,
out, and maybe you being the imaging professional say, "Hey, I'll volunteer." And then maybe you give them a perspective of like, this is what happens in radiology. Because a lot of people, especially in the hospital, have no idea what happens in radiology. Nurses have no idea. I have nurses come down and are like, I've never been here before. Like, what do you mean this patient's gonna be here for an hour? Huh? Like CT, they're kind of used to and knows, but especially like nuclear medicine, they're just not, they have no idea what goes down there. And then sometimes when they're down there, I'll use that opportunity to kind of educate them. Like they'll start asking me questions like, "Hey, what are we doing here?" And I explain to them. They're like, "Oh, that's kind of cool." And then they open up more, and then you build a relationship too with the nurses. I think it's always about building relationship with other people and communication.
that you hit the nail on the head. Working together, communication, it's all about the patient, and showing people what we do in radiology. And I think you've done an amazing job of that today. Thank you for being our guest. And I mean, I know I was blown away by all the things you said today. So I cannot wait until everyone listens to this podcast. And please let Nicole know how much you enjoyed learning about nuclear medicine and all the tips that you gave. It's been great. So thank you so much, Nicole.
Awesome. Thank you so much for having me on. This is a great conversation. Definitely would love to do it again
Oh, we
anytime.
are. You said some things. We're going to talk some more. And that's a wrap for this episode of A Couple of Rad Techs podcast. We hope you enjoyed our discussion of the fascinating world of radiology and learned something new about the role we play in the healthcare industry. If you have any questions or topics that you'd love for us to cover, feel free to reach out and let us know what they are. And you guys, please, if you enjoyed this podcast or any of the other episodes, we want to hear what you thought. Leave us a review. Mama's got to pay her bills. It helps. And until next time, stay tuned for more insightful and informative episodes of A Couple of Rad Techs podcast.